All right. Hi, everyone. Welcome to our journal club. So today I'm going to be talking about this article, which is actually in preprint, about PD-1 blockade efficiency in mismatch repair deficient locally advanced rectal cancer. So that's like a lot of words. So I'm going to try to go through and sort of explain what each of these terms means before we talk about the results of the actual study. So PD-1 is a protein, to my understanding, in your body called programmed death 1, which essentially allows your immune system to repair itself. So if there's an issue in your immune system, it can either help or prevent the T cells, which are cells that are a part of your immune system, a form of white blood cell, or B cells, which is the same thing, but slightly different, to repair damages in your body. So this study uses a PD-1 monoclonal antibody, which a monoclonal antibody is the way in which it was produced. So the way that it was made was they essentially got antibodies from mice, they bred the mice together, or they cloned the antibody over and over until it's exactly right, and then they use that in this medicine. Mismatch repair deficient is a kind of cancer in which your DNA, for whatever reason, does not have the correct protein in order to be able to repair itself if there is a mismatch in your DNA. So sometimes you have your DNA and you have your RNA. The RNA reads the DNA and helps build it. So if there's a mismatch in your DNA, if something doesn't get transcribed correctly, normally you have proteins that allow that mismatch to be repaired. But if you don't, then occasionally you can develop cancer because the mismatch cannot be repaired and then it kind of grows out of control. So in this study, they used the PD-1 blockade, meaning it's blocking the PD-1 protein, to treat locally advanced rectal cancer. And in this study, they focused specifically on mismatch repair deficient, which is what we just talked about, stage 2 or 3 rectal adenocarcinoma, which is rectal cancer. And stage 2 or 3 is rather advanced in terms of stages of cancer. So it was also followed up by standard chemoradiotherapy and also surgery. And what the study found was that a total of so they had a total of 12 patients undergo this treatment with the PD-1 blockade monoclonal antibody, which the name of the drug is dostarlimab. And they underwent 6 months of follow-up, and all 12 patients had a clinically complete response, meaning that they went into full remission and had no evidence of their tumor on MRIs, on any kind of imaging, even through an endoscopic evaluation or a biopsy. There was no evidence of the cancer anymore. And then when they published this report, they say at the time of this report, no patients had received chemoradiotherapy or undergone surgery, and no cases of progression or recurrence had been reported, between a range of about 6 to 25 months. So this study is still in preprint, so it hasn't been fully released, it hasn't been peer reviewed, and it was on only 12 people, but I would like to hear your thoughts about what this means in terms of cancer treatment in the future, because this is, I think, a pretty, it's a pretty new field in terms of treating cancer in this way, because a lot of especially for the more advanced cancers, we typically rely on chemotherapy or surgery or both to treat them. Radiation. And this is, or radiation, and this takes sort of a new approach.
Yeah, the PD-1 blockers were really miraculous. I remember seeing them at the very beginning when they were first starting to look at this, the Cancer Research Institute. The whole idea was this Dr. Old, who changed the game on cancer care out of New York, because his entire thing was about the immune system had some kind of regulatory problem which would allow cancer to happen. And it was sort of contradictory to do all this chemo and everything that basically annihilated the entire system to try to get at the cancer. It's kind of like pesticides. You know, you kill so many things and you hope you kill the things that are going to grow too soon and not kill everything else in the meanwhile and have too much collateral damage.
Right. Exactly.
So what was fascinating, for example, my mom who had lung cancer, we got her on a protocol with this, and it had been previously studied in melanoma. If you want to read up about that, there is some fairly compelling information, and so they're trying to look at it, other types of cancers. You know, there's things you have to think about: the type of the body, what body part, but also what type of cells. You know, squamous cells, solid organ cells. You know, what is it that you're trying to? What went wrong in those cells that then allowed the cancer to happen? And what is it you're trying to fix? So I think it's really extremely promising. When you look at some animal models on this back in the day before they got into the human, it was nothing short of a miracle to see these tumors everywhere and then them gone. It was unbelievable. So it's a hopeful thing, but it is not without toxicities. It is not a panacea. It is not an easy ride. It definitely has side effects, and you know, there's a price for everything.
Yeah.
So you still want to do everything we can to educate and encourage people to not smoke, eat more vegetables, not drink too much alcohol, to try to not live in toxic environments if they can, have a lot of antioxidants to help cleanse their system if they must. Because preventing cancer or finding it early is always going to also help to improve the ultimate outcome.
Right.
But I'm glad you collected this. It is a very interesting article. And I also want to point out that every June I'm always excited because it's when the ASCO, American Society of Clinical Oncology Convention, which is the hugest meeting of oncologists. It's like 20,000 oncologists come, you know, present from all over the world, and since they were able to switch to virtual, it's even more amazing in terms of the amount of information that's shared and moved forward. And the Cancer Research Institute also was really good about forcing collaborations and having people share tissue cultures and reagents and really encourage collective work and not all this competition thing, but to really work towards the goal of finding out what to do to help patients. That's what made them really be a leader in that field. Yeah. So yeah, I think that's really interesting stuff. What do the rest of you guys think about that, and just about cancer in general? It's a scary word, but it's something unfortunately a lot of people face, and certainly of course more disproportionate people of color face. Let me stop talking. Let you guys have the conversation.
I think it's really interesting, this article, even though it has like a small number of people who underwent the study. I think it could show like promising effects with other types of cancer, like not just rectal cancer. I think after I had an interview with, what was her name yesterday? Dasana yesterday, and she had a breast cancer scare, and it kind of made me like realize that we should be like thankful for our health every day. And cancer is this big scary thing, but as long as you like get it, like check yourself regularly and like be on top of it. It's okay to be scared, but your health should be like number one. Even if you like don't have like the resources, there are things out there to help you, and that you should always try to like, I don't know, be like thankful for like, I'm trying to think what else she said. It, like her interview was so amazing. But I think we're like living in this time where like I can't remember what I was about to say. Someone else help me out.
Yeah, maybe Johnny or Keisha. Do you have anything to add?
Can you hear me?
Yeah, but you're a bit quiet.
Okay, that's a bit strange. I don't know why I'm quiet. Let me see if I can fix that.
Okay.
Can you hear me now?
Yes. Yeah, that's much better.
Okay. So personally, I don't have like a lot of understanding of like the stages of cancer. I know that it was saying that it could like fix issues with like stage 2 and stage 3, but what exactly does that mean when they talk about cancer? Because from my understanding, when you hit around like stage 4, that's the point of no return in which they can't really do anything for you. So what is stage 2 and 3?
That would be a good question for Dr. Merritt
Yeah,
to answer,
that
I
is a
think.
good question.
So I'm in the Acapulco store, ignore the background music. But yeah, the stages of cancer, which Mariah, you can put down on your list to look up as part of our educational thing. If you look on our website, that's something we need to increase on the Know Your Body section, which will be good. But
Mhm.
the stages have to deal with the level of involvement. Stage 1 is usually superficial. And for each type of cancer, it's different because there's different staging depending on the presentation and the way in which the cancer usually progresses.
Mhm.
So stage 1 is usually like superficial, small, defined by size or things like that. Stage 2 means that it may be penetrating a certain layer of the cells. Stage 3 may mean local extension. Stage 4 is metastatic, widespread extension, often involving the bones of the brain or multiple other organs. That's a general rule of thumb. So
Right.
stage 1 and 2 is where we want to find it. That's why we do screening. Like a teeny lump is a lot easier to deal with, often resolvable with a lumpectomy in the breast, or a small lesion on the cervix, again, often resolvable in the office with, a wide biopsy, and it's done. When it spreads to the lymph nodes and the other tissues in stage 2 and stage 3, then things get more complicated.
Right. And that, to my understanding with rectal cancer, that is also where things get more complicated in terms of quality of life after removing the tumor, in terms of like ability to function from day to day, because you often have to implement things like colostomy bags, things like that, just because there may be so much tissue removed that it may be difficult to do those things on your own. Is that correct, Dr. Merritt?
Yes, that's correct.
All right, yeah. So yeah, it's interesting that you bring that up because there is nobody in this study that had stage 1 cancer. They were both stage 2 and 3, which means it's gone beyond a superficial tumor. Of course, to different extents for every patient and depending on the kind of tumor. But it was also interesting because the doctor who ran this study had done a couple of interviews and said that he believes that this is the first time that this has ever happened within solid tumor oncology. So when Dr. Merritt earlier was talking about the different types of cancer, the different types of cells that they can be made up of, this is a solid tumor cancer. So supposedly this is one of the first times that this has ever happened with that type of cancer, which is very interesting in my opinion, because there's a lot of cancers that are solid tumor cancers. So it's super fascinating. And of course, your digestive system is connected to some of the most important parts in your body, some of the most important organs. So it's really important to make sure that you get to it before that metastatic stage where it's spreading to other organs and, possibly to your bones and your brain.
I was also going to mention that it's kind of amazing because this seems like a less invasive procedure compared to like surgery or chemotherapy or radiation therapy.
Yeah. And it definitely isn't without risks, but I think, compared to having to sit in a room and get chemotherapy infusions, taking a pill is definitely preferable to a lot of people. So at the very least, it would provide people with some options regarding their cancer treatment, with how they want to tackle it. But as Dr. Merritt said, of course, it does have side effects. It can, cause problems. But yeah, I think and I also like the approach. I did not know that, as Dr. Merritt was explaining about the approach with wanting to use monoclonal antibodies for cancer, using the body's own immune system to fight cancer. I think that's just genius. because it seems like the whole point of chemotherapy is, well, we're going to give you this stuff and we have to give it to you in very careful doses because they can also kill you. So it's definitely fascinating and I think very promising. I'm hoping to see more research on this.
I wonder if like these types of therapies can also help people who have HIV and AIDS, like working with your body's immune system in order to fight
Interesting.
back. So I wonder if these kinds of treatments can also progress in like different other fields like HIV and AIDS.
Yeah, I would really like to know how, I've seen a lot of like messaging about PrEP, the PrEP drug, but I don't actually really know what it does. It's interesting because I've seen it a lot. I see it get advertised a lot, but I don't actually really understand what it does. So that might be something interesting that we could research and maybe, put that information out there so that people are aware.
Yeah, you can go on the Community AIDS Network or the Florida HIV/AIDS tip. We have some links somewhere in there, but that's post-exposure. The pre-exposure prophylactic treatment is what PrEP is, and the whole idea is it drops the viral loads to reduce the risk of transmission.
Interesting.
Wow.
So that's
Wow.
part of what the whole initiative, and I believe Becca had that on the info that we sent on the last newsletter for Pride Month was, one of the goals is to eradicate HIV by 2030. And PrEP is a strong part of that whole approach.
Right.
So
Yeah.
familiarize yourselves with that. Go through those links on the last newsletter and read some of that and learn some more about it. Because June 27th is National HIV/AIDS Testing Awareness Day. So everyone should get tested and know your status and encourage your friends.
Yes, definitely. Even if you think you are engaging in the kind of sex that could not possibly result in an HIV infection, you should still always be getting tested because you never want to risk it. Yeah, definitely, for sure. Maybe that could be an article that we talk about in the future. I think that would be really interesting. So yeah, Keisha, did you have anything to add? Do you have any thoughts about the article?
Hello, can you guys hear me?
Yeah.
Yes.
Yeah.
Okay. I don't know if I can introduce myself.
Oh yeah, sure. Yes, please.
Okay, yeah. My name is Keisha Georges. I'm a recent graduate of Southeast High School. I did my intern at Manatee Community Foundation doing nursing research and writing a blog. So now I'm kind of transitioned here with you guys for over the summer. So excited.
Keisha, it's a little, I'm sorry, I didn't mean to interrupt you. It's a little difficult to hear you. You were kind of muffled a little bit during some of that.
Hello?
Hello.
Now we can hear you.
Okay. Okay, there we go. My full name is Nikisha Georges. I'm a recent graduate of Southeast High School. I did an internship at Manatee Community Foundation. I'm still with them now, but for over the summer, I'm going to be with you guys and doing like some projects with you guys for over the summer.
Awesome. Super excited to have you. Thank you for being here.
Thank you. How I think about, what I think is very interesting, actually. A lot of close friends, family friends that we had died from cancer. So this is very interesting that this is now coming out. I really think that it could change the game. I can't really I don't really have a lot of stuff to say about it because, I'm just kind of like first time here or whatever.
No, that's totally fine.
I really think it's interesting. And if you could send the article, because it was kind of like skimmed through, but if you could send the article to my email, if we can get in contact about it, because I would love to read about it more and help you guys.
And I'll also put it in the chat in case anybody wants to read the actual journal article, and I'll email you some of the press that was covering it, some of the interviews that the main research doctor did, because they were pretty interesting. He talks a little bit more about the study and what we should take away from this, right? Because obviously it's still in preprint. There's only 12 participants. I have to keep emphasizing that just because I don't want people to get their hopes up too high, because this is a rather preliminary study, but it is incredibly promising. I mean, I think at least for a, you know, for a study at this stage, it's very rare to have every single participant be, you know, have some kind of remission or have, they call it a clinically complete response, which is even more, even a higher standard to my understanding than remission, where the cancer is just not present at all in any imaging or biopsy, which is rather incredible.
So this is something that we've never seen before.
According to the doctor who ran the study, yes, this is something that has never before been seen in solid tumor oncology. Yeah. Which is pretty incredible, I gotta say. Pretty amazing.
Incredible.
Yeah. So, you know, I just felt when I read it, it made me very happy reading the stories of the people who were in the study talking about, you know, how happy they were, you know, they were very optimistic in the future looking forward, and just feeling a sense of relief, you know, because they know that now they can sort of continue on their lives, probably not quite the same way that it was before, but they feel like they have, you know, more of a fighting chance, which is really what we want. Because I think so often that people with cancer sort of feel a little nihilistic about the whole thing. Like, what is the point? There's, you know, I think a lot of depression can come up with being diagnosed with cancer. And I think that if we can even just give people the security, you know, the safety of mind to sort of be like, that's not true and I can do this. I think that makes a huge impact, honestly, on a person's, you know, willingness to fight and recover.
I agree.
So yeah, we've hit just about 30 minutes. So if there are any final comments, final thoughts, now would be the time to say them. Otherwise, we're going to wrap up and end the recording.